Okay, welcome everyone. I'm Sharice Magoon, and I work in the Department of Lifelong Learning at UT Health San Antonio School of Nursing. I'll be moderating the session today. You were sent an email this morning from Cynthia Gutierrez. At the bottom, it explained how to complete the evaluation and get your CE certificate. If you have any questions, you can get with her after the presentation via email. And in the chat right now, she's going to type her email in the comments section, so that way if you need to reach out to her. This symposium is sponsored by Texas Health and Human Services Commission in partnership with the UT Health San Antonio School of Nursing. Texas recognizes June as Neonatal Abstinence Syndrome Awareness Month. You can learn more by reading House Bill number 405. Please keep your camera and microphones off during the presentation. Hold all questions until the end of the presentation, and then you can type in the comments or unmute. And I'll read the questions out loud. And just so you know, we are recording. And I'll hand it over to you, Dr. Cleveland.
Thank you, Sharice. Hello, everyone. Thank you so much for being here with us today. We're really excited to share with you some work we're doing here in San Antonio to better serve the families in our community. My name is Lisa Cleveland. I'm a professor at the UT Health School of Nursing. I am a pediatric nurse practitioner and a neonatal nurse kind of by trade. And so really the way we wanted to design this panel today is I'm going to go through just some really brief slides to give you some background on this project and really talk to you about how it came to be. It didn't happen overnight. I think that's really one of the take-home messages. It took lots of community collaboration and partnership that is ongoing. And so I just want to give you a little bit of history on that. We have several of our community partners here with us who have contributed so much to this project. As soon as, I've kind of gone through the slides and the background, I'm going to give each of them an opportunity to introduce themselves, talk a little bit about their role in the project and the expertise they bring. And then we really want to open this up to conversation. We want you to ask those questions that may be in the back of your mind. If you're thinking you might want to do something like this in your community, we really want to be here to answer those questions for you. So I'm going to go ahead and share my screen with you. There we go. So the title of our project is, or of our panel is Building Collaboration, Building Collaborative Capacity to Serve Women and Children in Recovery. And so these are the logos of some of our wonderful partners who, without them, we could not be doing any of this. And we want to talk to you today about the San Antonio Women's Wellness Campus. This is a rendering of it. We're really excited. We had our groundbreaking last November. We had the ceremony last November, which was really exciting. We got some great press about it. But now we want to talk to you a little bit about how it came to be, and then talk to you about really the process for the project. So I have to back up just a little bit to, I guess, actually all the way back to about 2011. I was a doctoral student at UT Austin at the School of Nursing, getting my PhD, and was doing some research. I think I mentioned that my background is in neonatal, and was doing some research looking at the experiences of families who had infants in the NICU. And I had not been in the San Antonio area very long, so I didn't know the community particularly well. And, kind of an interesting thing happened, which, they say if you're doing good research, you actually end up with more questions than you began with. And so in this case, that really was true. What happened was, as I was interviewing families, I began to get a lot of calls from families whose infants had been in the intensive care unit because they were born withdrawing from opioids, something that we call neonatal abstinence syndrome. More commonly, we're now really seeing it being referred to as newborn opioid withdrawal syndrome. It's really the same thing. These are just physiological symptoms of withdrawal. But, I began getting many calls, and I started to wonder what's going on in my community that we have so many families who are being impacted by this. I had taken care of babies who'd been born withdrawing in the Houston area several years before that, but nothing like the numbers I was seeing in our community here in Bexar County, the San Antonio area. And so what I learned was that pretty consistently, about a third of all cases of neonatal abstinence syndrome, those infants are born right here in Bexar County. So this was something that was really, really impacting our community. And in working with these families, what I discovered was, the ICU experience was really, really stressful for all of the families. But for this particular group of families, they were dealing with a whole other set of circumstances that I was not seeing in the literature. When I went to the literature, I saw nowhere did I see the voice of the family or the stigma, the discrimination, the other types of things they were dealing with. And so, once I completed my dissertation, I just really wanted to work with this group in our community. And that just kind of started everything. It really started the ball rolling to what has been an incredible career, I might mention. It's been incredibly fulfilling. And so I think it was about back in 2016, 2017, we applied to the Patient-Centered Outcomes Research Institute. What we wanted to do was to begin a collaborative here in our community to really look at how do we address this and make lives better for the families here in our community. For those of you who may not be familiar with the Patient-Centered Outcomes Research Institute, we often refer to that as PCORI. PCORI tends to be really interested in research and projects that are focused on the voice of the patient, right? And those outcomes that really matter to patients. We don't think of the families we serve as patients, we call them partners. So they're really our family partners. And so this project was actually funded for 2 years, which was really exciting. It let us kind of really get it launched and get it started. And the goal of this project was to improve the well-being of families impacted by neonatal abstinence syndrome through education, research, practice, social equity, and community engagement. And again, this was really focused on the outcomes that matter to families, which is interesting because as an academic researcher, I had my ideas of what I thought families were going to be interested in. I very quickly learned that I didn't know anything. And I think something we oftentimes get wrong in academic research is that once we've engaged with community and we've asked them what they think, what they want, we better follow through or we're not going to be invited again. And so we really worked together. This partnership was made up of researchers, clinicians, community stakeholders, but really at the heart of this partnership, this collaborative, were the families we serve. And so we held what we called community conversations. So it was coffee and donuts and conversations. They really, I guess technically were focus groups, but nobody knows what that is. So we just said, hey, come have a cup of coffee with us, talk to us about where you think we should be focusing our efforts. And again, it did not end up going in the direction I thought it was going to go. So a few of the kind of the priorities that the community stressed to us was, first of all, here's our community that's really being impacted by this public health issue, but there is no place for women to go where they can recover with their children. Typically babies go with, if they're fortunate, they go with a family member while mom gets treatment and recovery support services. If they're not lucky, they go, maybe into foster care, which is traumatic for everyone involved. And so that was something that they really wanted to see improved. The second thing that came out of these conversations was that they really wanted to better understand the potential developmental impact of opioid exposure and other types of substance exposure on their child. Again, not the direction I thought we were going to go. I'm a nurse. I, at that time, knew nothing about recovery housing. And so at that time, one of the staff at the Texas Health and Human Services Commission, I had gotten to know pretty well, and we'd been doing some work together. She said to me, this is Lisa Ramirez. She said to me, well, why don't you write us a proposal for recovery housing and we'll see if we can fund it. And so I did. I wrote a proposal that would allow for moms and babies to stay together in a home like, group kind of living setting. And to my surprise and actually shock, it was funded. And I say shock because I suddenly had a funded program and I had no place to put it. And, I'm told often that the university is not in the real estate business. So this was really like a conundrum, right? Where where am I going to put this funded program? We now have deliverables. We need to be serving families, and I have no place to put it. And so after several failed attempts to partner with other organizations, at the time, Dr. Colleen Bridger was the director of our Metropolitan Health, that's our local health department. She knew Dr. Kevin Downey, who you're going to get to meet in just a few minutes. He's the CEO of a local nonprofit, Crosspoint. She happened to know that Crosspoint had a house and a program for women that had been struggling to stay funded, and they were trying to figure out what to do with that program. She also knew me, knew that I had this funded program and no place to put it. And, again, after about a year of trying to partner with other people, I met Dr. Downey. And honestly, I think in 30 minutes, we had a plan. We were going to move our funded program into their beautiful home. And you'll see a picture of it in just a few minutes. We were going to partner with their staff. And it just was amazing the way it came together. And so that program opened the very end of 2018, November, December. We called it Casa Mia. And this is a picture of one of our mamas and babies on the sun porch. So Casa Mia really it's a partnership between the UT Health School of Nursing and Crosspoint, who you're going to meet here in just a few minutes. This is their beautiful home, prior house in the historic Monte Vista neighborhood. The house has the capacity for 20 women and children. We've had multiple different funding sources. So we've had continued funding, partial funding from the Texas Health and Human Services Commission, some funding from the Baptist Health Foundation, from the Sisters of the Holy Spirit. Sister Gabriella is here with us today. You'll get to meet her. And so this really is recovery housing. The women we serve are accessing intensive outpatient treatment through some of our other community partnerships. That seemed to work best with this particular model. That's something that may be changing and growing a little bit as we begin to open the new campus. And we'll talk about that more in just a few minutes. It's been an amazing experience. So for the families we serve, I think for those of us who are partnering together, it's just been an incredible experience. But I have to say, for the students I serve at the School of Nursing, it's been incredible for them. Oftentimes our undergraduate students have a very narrow focus, a very narrow life worldview. And so this has been incredibly eye-opening for them. We take our students who are seniors in their final semester of population health, and they do some really great educational projects with the moms and the babies. And I personally think that our students get more out of it even than our moms do, even though our moms love it. We do also have a part-time, one of our faculty who is a population health maternal newborn nurse, spends some time there with the families, doing some parenting education, health education, and et cetera. We also have a registered dietitian who spends a day a week there. Really, she was brought onto the project to work on nutrition with the families, but she's started to implement some what she calls therapeutic gardening, that the women have really taken to. That's going to be a large focus in the new Women's Wellness Campus. And one of the really exciting things, I think, is that this program has been really successful. We've pretty much been at capacity since opening, which is why we need the expansion into the Women's Wellness Campus. But because of the success of the program, we now have received some additional funding from the Texas Health and Human Services Commission to replicate this model in 2 other communities. And so we chose 2 communities that are in the top 5. You saw that table earlier in the top 5 for incidence of neonatal abstinence syndrome, one being Corpus Christi in Nueces County. And in that county, we're partnering with a nonprofit called Dismiss to replicate Casa Mia there. And then in Fort Worth, we will be partnering with West Care. And you will meet Ms. Beverly Watts Davis in just a few minutes. She is their president. And so we're in the process of replicating that, which I think is really, really exciting. So now to really, the purpose of our panel is really to talk about the process. So how all this came together and how we're working together as community partners. So really where we began again, this is being funded by the Texas Health and Human Services Commission. We had an opportunity to put together a proposal for some additional funding. And one of the things I've always really thought our community needed was a women's campus or women's wellness campus, similar to, some of you may be familiar with the Santa Maria Hostel in Houston. It was always puzzling to me that we didn't have something similar here. And I had been speaking with some of the program staff at HHSC, and an opportunity came for us to put together a proposal. And that was what we proposed. Once that was funded, we really realized that we needed more community stakeholders. We needed much more input from a variety of different viewpoints. And so I borrowed a concept from another community partner. I actually had the pleasure of being part of a visioning committee for a new daycare child development center here in town called the Healy Murphy Center. And it was just such an incredible experience, bringing together experts and community stakeholders to really dream up and vision what this should look like, the services that should be provided, even to what the building should look like. And so I borrowed that concept and we replicated it. And so we formed a visioning committee. And the purpose of this committee was to provide guidance on the design, ideation, populations to be served, and the programming that would be provided through the new Women's Wellness Campus. And I'm going to show you a list of who all participated in these visioning committee meetings. It was local community leaders, including Crosspoint, the School of Nursing, our School of Medicine, clinical and programmatic staff, faith leaders, most definitely. And then we had some really great support from community and political stakeholders. And then again, similar to what we did with the Bexar County Neonatal Abstinence Syndrome Collaborative, at the very heart of this visioning committee, we all felt very strongly needed to be current and former program consumers. So we needed to have input from families who had participated in the Casa Mia program, because they've been very, very instrumental in helping us continue to improve the programming we offer. And so Tiffany's here with us today. You'll get to meet her. We also were adamant that we put a limit. So these are busy folks, right? I mean, we're all busy, but these are really busy folks. And so we promised them there would be no more than 6 meetings at an hour to an hour and a half each. And so we met between August and January, and it was amazing what we were able to accomplish in that short amount of time. So here's a list of who participated in the visioning committee. I have to mention that our committee chair was Sister Gabriella Lohan with the Sisters of the Holy Spirit. She kept us all in line, made sure we kept moving forward. She's here today. She can tell you what it was like to herd a bunch of cats, because I'm pretty sure that's what it was like. But you'll get to speak with her. And then I'm going to give those members who are here with us today a minute to introduce themselves in just a second. So we mentioned a little bit about, the design, similar to a campus located in Houston. In our minds as a visioning committee, we kind of have 2 phases of this campus build out, campus development. In phase 1 will be a larger Casa Mia program. And this is a rendering of it you see on your screen. We will have the capacity for 40 rather than 20, which is going to be really amazing. It's also really nice we were able to design it all in 1 story, which is much more accessible for our families. We are also going to have an integrated wellness center that I'll talk about in just a few minutes. And that wellness center will also contain a newborn withdrawal center. Again, I'll speak about that in just a second. And what's super exciting about this is we all feel pretty strongly that this really could become a national scalable model of best practices for serving women and children in recovery. So more specifically about the Integrated Wellness Center, as a nurse practitioner, this gets me very, very excited because it fully integrates what we typically think about as physical health care services right along with mental and behavioral health care, no longer separating them out, which I think is really, really timely considering what's happening in our nation right now. We need to be thinking about the whole person, and mental and behavioral health is absolutely as important as physical health. And so this really is a nurse designed and operated primary healthcare center. Crosspoint will be operating a behavioral healthcare center that will kind of be down on the other end of this building that you see in the lower right-hand corner. We'll be able to provide a primary and pediatric healthcare, nutrition, lactation support services. There will be the behavioral and mental health services. I'm also really excited because I think this is going to be an amazing clinical site for our faculty practice, as well as for student learning. And then, a little more specifically about the NAS Center, which we're going to come up with a way better name for that. So if anybody has any ideas, let us know. Right now, we're just calling it the NAS Center. But as a former neonatal nurse, this is really, really important to me. As many of you may know, oftentimes babies who are experiencing withdrawal are sent to special care nursery or ICU, where it's really less than ideal, right? These babies are very, very irritable, similar to, a very colicky baby. If any of you have ever had a colicky baby, they really want to be held and comforted and soothed. And that is really, really difficult to do in a traditional hospital environment where you may have one nurse for 3 or 4 babies. Like that's just not really practical or possible. We also, any of you who've worked in a NICU, we tried to keep the NICU very, very quiet, but that's difficult to do when you have a lot of babies, particularly fussy babies who are crying. Oftentimes one of them will set the rest of them off. And so the really amazing thing I think about this NAS center is it will be very much a home-like environment with 10 private rooming in rooms. And the idea is for whoever that primary caregiver of that newborn is going to be, whether that's birth mom, grandma, dad, foster parents, whoever's going to be taking care of that baby will be there to provide that one-on-one, customized, very soothing, comforting care for that newborn. Some of you may be familiar with Matt Grossman's Eat, Sleep, and Console model. If you're not, we had him come and speak at the NAS Symposium, I think 2 years ago. Sharice could probably confirm that. That's recorded. You can watch his presentation. He's amazing. He's a general pediatrician. And I had an opportunity to meet him personally and present with him a few years ago. And we're very like-minded. Being a general pediatrician, he believes that babies are babies and they belong with their caregiver. And so this model is very much less focused on a medical model and very much focused on soothing techniques. And what he's found with his model is that, babies spend much less time in the hospital. Way fewer babies require any type of medication to get them through that initial withdrawal. And families just bond better when they're together. Any of us, I think, who work in maternal newborn already really know that it's just a very practical approach. And so with this NAS center, we'll have these private rooms. We will have 24-hour nursing care oversight. So there will be a registered nurse there. We will also have our nurse practitioner practice. We'll be rounding on the babies and then really collaborating with our School of Medicine. Our medical director is Dr. Robert Nolan. He's here today as well. And so you'll get a chance to meet him. So phase 2, and I'll let Dr. Downey talk a little bit more about this in a few minutes. Phase 2 really is going to be Crosspoint moving over their other female populations. And again, Dr. Downey can speak better to this, but Crosspoint does serve other female populations. They plan to operate a capital campaign to do the additional fundraising for the second phase. But some of the women to be served will be homeless female veterans, women who are in our human trafficking Esperanza courts, other justice system involved women, which is very, very exciting to me. And then women who are being reintegrated back into the community after discharge from a mental or behavioral health care facility. And you can see just kind of a rendering of some of these facilities. The top one is an example of what a phase 2 residential facility might look like. And then the bottom one, we will have a dining facility, which is really exciting. And we intend to have a demo kitchen. A lot of our moms really like to cook and have a great interest in the culinary arts. And so I think this demo kitchen is going to be just an amazing addition. So one of our more recent partners, and this is my last slide, I promise I'm going to turn it over to the rest of the group. One of our more recent partners is the West Care Foundation. We had an opportunity to put forward a proposal again to Texas HHSE to kind of look at, where might we want to go from here. One of the pieces we feel like we will continue to be missing from this model we're building is a supportive housing program. So even now, we notice that when our families kind of essentially graduate Casa Mia, if we're going to lose them, that tends to be when it happens. A lot of our moms work at, in the service industry where they're not making a very, good income. And so to be a single mom, we all know what housing costs nowadays. It's really, really a challenge. And so we oftentimes keep women longer, I think sometimes because of that at Casa Mia than they necessarily need to, or sometimes we'll get them back. And because again, they just have a lot of difficulty transitioning and making ends meet. And so we proposed a supportive housing pilot. We were so fortunate to find partners in the West Care Foundation. Beverly Watts Davis, their senior VP, is here today. She can talk more about that. In addition to the supportive housing model and the Casa Mia replication in Fort Worth, West Care will be building a child development center on the campus here in San Antonio, which is really, really exciting. They'll be sharing their early Head Start program in that center. Also, I think it's going to be an amazing site for developmental follow-up research, which again was one of the needs identified way back when we did the Bexar County NAS Collaborative. So we'll be able to follow through with some of that work. And just really excited about this. And I think we'll go ahead and turn it over and let some of our community partners introduce themselves. And let's start with Dr. Downey over at Crosspoint. I'm going to stop sharing my screen. Dr. Downey, I know you've got several of our members of our visioning committee with you. I'm going to turn it over to you and let you all talk for a little bit, and then we'll just kind of continue and have each of our partners talk, and then open it up for questions and comments.
Thank you so much, Lisa. It's a pleasure to be here. I was CEO of Crosspoint, providing transitional and behavioral health services. We started in 1963. I didn't. I was doing it for about 20 years, and I'm currently the Chief Strategy Officer for Crosspoint. I am so happy that we got to meet Dr. Lisa Cleveland and all of our other partners, because Crosspoint has always looked for opportunities to build strategic collaborations and innovative program designs to meet the evolving needs of this growing community of San Antonio. And this, to me, was a giant step in that direction. Lisa mentioned that this doubled our capacity from Casa Mia, but I think the other important thing to point out is that it also allows us to now provide these same services for moms and babies who have other substance use disorders, because we could never do that before at Casa Mia. And we have gotten calls from various judges and other stakeholders who have said there are other problems in our community, especially the minority community, with regards to methamphetamine, cocaine, other drugs that you can't serve right now. I am currently in the flagship facility of Crosspoint. This is a 86,000 square foot former convent, and I'm with two of our key stakeholders that were at the beginning of this project. And as with any project, you have to reach out to political leaders to find out who you need to have in the project to make it work. Well, I talked to Commissioner Tommy Calvert, who's this precinct's commissioner, and he said, Kevin, you need to talk to someone named Dan Martinez, who's an opinion leader, and to Verna Eskridge, who is a longtime resident of the Delcrest area neighborhood, which is the neighborhood where this is being built. So today I have with me Verna Eskridge, and I also have Sister Gabriella Lohan, who is the a longtime sister with the Sisters of the Holy Spirit. And she is also was the chair of our visioning committee. And as Lisa said, that was a cat herding experience. So I was going to have them. I mean, I have plenty more to say, but I'm going to let them introduce themselves so you know who we're talking to. I think we're going to start with Verna because she's right next to me. Let me see if I can move this.
Good morning, or is it afternoon yet? My name is Verna Eskridge. I've been a member of the Delcrest neighborhood for 65 years. When I was 19 and expecting a baby, we picked out our lot and there were 5 houses in Delcrest. The people that were in those 5 houses have all passed away. So I have been in Delcrest longer than anybody. And now there's 1,400 houses. And I helped form the Delcrest Area Neighborhood Association, which we call Dana. And I've been there a long time and I'm not leaving. And so I'm interested in anything that goes on in our neighborhood. And when I heard that this project was going to happen, I heard about it and I volunteered to be on the visioning committee and, to represent our neighborhood and make sure that everything was going well. Some of the people in the neighborhood were a little nervous about it because they didn't know what it was going to be like and they didn't take the time to find out about this project. And so they were kind of opposed to it, but I think maybe they've all now decided that it is a good thing. I hope so. I just thought it would be a good thing to have help women to get a better life, and especially people who were in a situation where they were trying to recover from drug addiction or whatever their problem was, and to have a safe place to live and somebody to help them take care of their babies if they had babies. And I just think it will be making a difference in our neighborhood to have people coming through this program and living a better life. When I worked, I was a field executive for the local Girl Scout Council. I retired after 25 years with the Girl Scouts. So my whole life has been helping people and helping young ladies do better. So that's why I'm here.
Thank you. I'm Sister Gabriella Lohan, and as we heard, I headed the visioning committee. And indeed, it was a pleasure. And where we got to was marvelous. We did wonderful work. And I'm a Holy Spirit sister. I live across from our old convent. We sold our own old convent. It wasn't an old convent, it was a beautiful convent, but it was too large for us. So so I've had a lot of experiences, and I thought there would be helpful experiences when I heard what Dr. Downey was doing. And I had retired for all practical purposes, but I had excellent experiences. I taught kindergarten for the first 4 years of my teaching life. Then I taught 6th grade for the next 6 years. And then I became a principal and remained there for 20 years in 3 different Catholic schools. I then became a treasurer for my own congregation, and I had 20 years in money management. And then I have also been a member of, I also did community organizing with an IAF organization, and I've been doing that concurrently with other jobs I had for the last 35 years. So I knew I had a lot of skills that would be helpful to Dr. Downey and to Dr. Cleveland if I came into this organization and gave the last few years of my life, I think, are the best years of my life to the program. I have the other good experiences I had is I oversaw the building of a 63 new convent for a 63 bedroom new convent for our own sisters. That was some experience. And as I look at it now, I know some things that I forgot to do and some things I forgot to say. And so that is helpful to me. I'm reminded sometimes of what I forgot. And so that was a great experience for me. I got involved with Crosspoint for those reasons. Now, the mission of my congregation is, we were founded in 1888 for the education of the newly emancipated Negro, as they were called in that day. I think I have said everything. Dr. Downey is telling me I have 3 minutes, and I think I have used them. It's been a pleasure to be here. This is another new experience.
Thank you, Kevin and Sister and Berna. I'm gonna hand this over to Dr. Nolan in just a second, but before I do that, I've got to give a little shout out. So I've been communicating with Karen Palumbo in the chat box. So Karen, Karen, at the time we began all of this, was at HHSC. And I'll never forget the day Karen called me and said, oh, we have some funding, and if you could do anything you wanted to do, what would it be? And oh yeah, you need to get it to me by 5 o'clock today. And that was at noon. And we did it. And Karen believed in us. And so thank you, Karen. You're amazing. Dr. Nolan, I'm going to turn it over to you.
Yeah, my name is Dr. Robert Nolan. I'm a professor of pediatrics. I'm a general pediatrician, not a neonatologist. And my role on the visioning committee was to provide medical support and liaison back to our faculty and other physicians in the community. I've cared for neonatal absence infants in the past, and having an infant in the neonatal intensive care unit is truly terrifying for parents. I mean, it's noisy, people are fluttering about, doing things you don't understand, alarms are going off. And then at some point they hand you your baby and say, okay, it's time for you to go home. You know, good luck with that. I mean, that's a bit of an exaggeration, but I think one of the very wonderful aspects of this program will be helping young women gain confidence in themselves, to gain agency, to gain effectiveness. You can take care of your infant. And you can do it as well as trained professionals, with those professionals in the background as needed. And I will be providing medical direction. There needs to be a physician's name someplace on many different documents. And I will be validating the incredible care that's provided by our nurses and nurse practitioners. And I'll be working with colleagues at the School of Medicine to create the transfer protocols. When is a child ready to leave the hospital to be cared for in a less intensive situation? And the care protocols, not only for the NAS program, but for the primary care clinic that's going to be associated with the Women's Wellness Campus. And so this has been a great joy to me. I'm also an associate dean, so I spend a lot of time pushing paper around. And I don't get nearly the satisfaction from that as I do from having collaborated with Dr. Cleveland and the other incredible individuals in the School of Nursing. So thank you for allowing me to be your partner.
Thank you, Dr. Nolan. Beverly, would you like to introduce yourself?
Well, can everyone hear me? I'm Beverly Watts Davis, and I am the Chief Officer for Resource Development and Program Support for the West Care Foundation. But I am a longtime, San Antonio. I'm a San Antonio grown girl. So, and the village that Kevin speaks about in the area that he's in was the village and is the village that raises me and continues to guide me. I'm for all the people who are there. Throughout my entire life, they have been influencers truly in my life. So I have been in the field in terms of prevention for a long time. I actually worked at the Substance Abuse and Mental Health Services Administration. I was the director of the Center for Substance Abuse Prevention, was later promoted to the senior advisor, and then literally had purview and guidance over all three centers: Center for Substance Abuse Treatment, Center for Mental Health Services, and the Center for Substance Abuse Prevention under the administrator as a senior advisor. So I really do understand the funding aspect of our field, of the field of behavioral health, and was just very, very pleased. I was a longtime advocate for Crosspoint. In fact, when Crosspoint was actually coming into the community, the organization that I had founded, San Antonio Fighting Back, was one of its chief supporters, and I was keeping up because the staffing that was still there while I was in Washington was constantly keeping me up on what was going on in terms of Crosspoint. And again, thank you, sister, because you were a game changer in terms of allowing Crosspoint to buy the convent and to be able to put services there. But the other thing, my expertise actually comes in interesting forms, because not only do I do what I do with the West Care Foundation, and we're a national foundation that really focuses on behavioral health and health and human services, as well as community development, because we know that the continuum is our goal is to help people to get well, not just get better. And you need all of it. And as I shared with Lisa earlier at the beginning of this call, none of us are as good as all of us. And what she has shown is the key to the partnerships. And what West Care has brought to the table is we actually do have a residential, we actually have housing for women with their babies in Vegas. We have this also in California, in Florida, and in Kentucky. And so we had some experience with really being able to make that a true success. But even more importantly, in my role as the chair of the Ella Austin Community Center, Ella Austin is the actual entity that is in what we call Deep East, the east side of San Antonio, that has the Early Head Start program. And we have been literally working with drug-exposed infants for 30-something years. And many, many people because they have the Early Head Start program at Ella Austin. So you really do, there's a natural learning that comes with addressing babies, because again, in order to get into Early Head Start, you have to be economically disadvantaged. And that's the only way you can actually get in. So many of the people that we're dealing with are people who actually may or may not have received treatment or couldn't get in, but they're still trying to deal with their children. And we work with a lot of those children. So we had just the grassroots, on the ground, sort of raw experience with many of these babies. And when I was so pleased when Dr. Cleveland and Dr. Downey talked to me about this, because again, I saw this as an incredible opportunity to be able to learn more and to be able to share with the other Head Starts around the country, but not only them, but the other caregivers in our community. This is daycare providers, Head Start providers, which is different than Early Head Start, but also foster parents and grandparents who are now taking care of their grandchildren. They have no idea what they're in for. And what I am so grateful to Dr. Downey and to Lisa is that there's a body of knowledge that they are developing that will truly help these children early. Much of the funding, and I know because I was a part of getting the funding in for pregnant postpartum women and lots of treatment in the country when I was, when I was there at SAMHSA. But also what was really key is the fact that we have lots of money that are working with the mothers. But what is unique about what Dr. Downey and Dr. Cleveland are doing, and this was when I began to work with them, I said, what about funding that's actually for the care of those babies? And was able to communicate some of that with SAMHSA, and they're actually beginning to look at funding and have actually put out some announcements to actually fund that. Because if you all think about it, we've always, the mother is absolutely key, because there's always an assumption that that will be the primary caregiver. In most cases, that will be the case. But there are things that we could teach her in terms of parenting that will help with the developmental, with the development of that child. Because those children are going into early Head Start, and then from early Head Start, they're going into Head Start, and then Head Start into kindergarten, into the school system. And when you look at the special ed rates in San Antonio, you guys, we can track so many of those children right back to their days at Ella Austin, in terms of literally being able to be worked with. Those that we worked with who have been successful, and those children who haven't are struggling in our school system. But we have coined this phrase of, you know, for children who are not getting the developmental help that they need, they end up being relegated to the back of the classroom, then to special ed, and and many times the mother doesn't even know how to work the school system so she can get the right care for her child. And many times she's ashamed to say anything, so that child doesn't necessarily get the services that they're entitled to. And that child then ends up falling further and further behind, and they become prime for, you know, for being recruited by gangs and drug dealers, et cetera. And we see this as the prison to pipeline, you know, this, the school to prison pipeline that we want to be able to stop. And so I just, our experience in residential housing for women with babies was just played right into being a key part of what Dr. Downing and Dr. Cleveland were doing. And the added bonus of that is to begin to work with them so that we can actually help share with the nation the things that can be done for people who are, whether they know it or not, who are caring for children who have been drug exposed. So it's been a real blessing.
Thank you, Beverly. We're so glad to have you. I'm going to let John introduce himself, and then Tiffany, and I think that should be all of our visioning committee members. If I'm forgetting anybody, please let me know, and then we'll turn it over for questions. John?
Thank you. My name is John Hertz. I'm an architect and a board member of Crosspoint. I'm a longtime collaborator with Crosspoint, almost several decades. I think I've worked on every project that Crosspoint has done, either pro bono or as a consultant. So I have a really good idea of Crosspoint programs, and I'm a true believer in Crosspoint's mission. I served on the visioning committee, and I was also the chair of the design committee, which got more into the nitty-gritty of creating the campus. And I would like to mention very briefly, a couple of salient points about the campus design, which you saw an aerial drawing of. And hopefully you noticed that it was built around, or is being built around, an atrium space. So we adopted the traditional idea of a campus built around a green space in the center. And we did this for a number of reasons. One is we wanted to place a play area and a therapeutic garden at the center of the campus. And this therapeutic garden actually is functioning because the produce from the therapeutic garden goes to our dining facility. And as Lisa mentioned, a lot of the women are interested in pursuing careers in the culinary arts. So this is an entire food chain from growing to consuming right within the facility. The other is that the campus is located right next to a major freeway. So by creating an internal space, we were able to use the buildings to create a sound barrier, to create a more tranquil environment. We were concerned that the facility not be institutional in its look, that it would be more residential in its scale, so that we opted for creating single-story buildings, even though that reduced the amount of square footage that we could provide. The campus is hopefully, I'm a true believer in the idea that architecture affects human behavior. And so we were very concerned in creating a healing environment, an empowering environment, an environment that was scaled to women and children, and an environment that would really help in reintegrating individuals back into society as contributing members. Thank you. A pleasure to be here.
Thank you, John. Tiffany, you're next.
Hi.
Hi.
My name is Tiffany Harper. I was one of the first graduates at Casa Mia. And before I introduce myself, I just want to say how grateful I am for Dr. Cleveland, Dr. Downey, and everyone who's been a part of getting this together, because you guys saved my life, like completely. I struggled with opiate addictions for about 11 years. I got pregnant, and of course, my first year of recovery and completing, certain requirements for CPS, I didn't have the funds to get my own apartment, to get my son back. And what a God piece, right? That this program had just opened up. So this gave me the opportunity to get my son back, a safe place. And I'm truly grateful for that, because I don't think I'd be where I'm at today and the success I've accomplished and the accomplishments that I plan to have. I currently work for Crosspoint now, which is pretty awesome. This is really given me tons of opportunities. And I think it's really important to have like someone on the other side. And so that's kind of what I do, like my input. And I think that's really important, because this is a long life journey. And sometimes it's, being on the opposite side of me, you can have all these ideas and things like that, but I can like suggest things that have worked for me. I just celebrated 4 years of sobriety. I'm currently going to school at SAC to get my LCDC. And these are the accomplishments that I've been able to do because of Casa Mia. And I think it's so important, because there's not very many opportunities or places like this that are beneficiary. And I think it's really awesome. Like I said, this place really changed my life, and I know it's going to change others for sure. But thank you. And I'm truly honored that I got to share my story a little bit. And thank you everyone who's put this together, and you're going to save many, many lives. I know it. Thank you.
Thank you, Tiffany. We're so grateful for you. So Tiffany, were you the first mama to move into Casa Mia, or the second? I can't remember. You were one of the first.
I think I was the second.
Okay. And she was so gracious and patient with us, because the program has evolved, and it gets better all the time because of your input and input of our other program participants. So thank you for being gracious with us. We appreciate that.
Well, I appreciate you guys.
How old is Matthew now?
He is 4.
I can't believe that.
Yeah. He learned to walk there at Casa Mia. So. He
did.
Yes.
Thank you. So we would love to now open up to the audience for if you have questions or comments. If there are those of you who may be interested in doing something like this in your community, if you're wanting to know a little bit more about some of the hurdles we've jumped over, because there've been many, we would love to field some of those. So Sharice, I see a question about how do I refer patients to Casa Mia? We actually have a website. Tess, I think you're on with us. Would you mind putting the website in the chat box for Michelle? Women can self-refer. That was something we all felt very strongly about. You should not need any type of special referral. If you need help, women should be able to go to the website. It really is just basically give us your name and a way to contact you, and the staff will call you. So Thanks, Tess. So that is that is now in the chat box. Other questions?
Can you hear me, Dr. Cleveland?
I can.
Okay, sorry, my chat is frozen. So
Oh, okay.
of all the days. So if you don't mind, since you can see it, and
I
please, if
can.
anybody feels like unmuting and they want to say something out loud, we don't mind seeing your face and hearing your voice. We would love to.
So, okay, one of the questions is Casa Mia only for moms with OUD? So initially it was, you know, many of you may know about some of the funding that has come through the Substance Abuse and Mental Health Services Administration. We have received some additional funds from a different source that now will allow us to provide services for women with any type of substance use disorder. We originally were somewhat disappointed when these funds were earmarked only for OUD, but our approach really was, you know, let's build it and hopefully they'll come. And, you know, we use that initial funding as let's build the infrastructure with the belief that there will be a broader perspective in the future. And fortunately that happened. And so now it's in place and we're thrilled to be able to open it with the new campus to women with any type of substance use disorder. So there's what are some challenges you have faced in starting WWC? I might let Dr. Downey take a first pass at that because I have learned so much. Right, Kevin?
Yes, I believe you have. I found out after we started this thing that Dr. Cleveland was unaccustomed to being sued. So she got to experience that with me. And the way this works with any program that Crosspoint has ever opened, somebody either sues us or attempts to sue us because neighbors are afraid. And I think Verna Eskridge did a very good job of explaining this. You're afraid of what you do not understand. So it's incumbent upon anybody who's going to open a program like this to get in front of it, to do some preemptive education. And I would suggest that anybody who wants to start one of these programs, you can avoid challenges or mitigate challenges by, first of all, reaching out to elected officials who have a heart for such things and let them guide you to other people to contact to collaborate with. In this case, I said that we worked with Commissioner Calvert, who pointed me in the direction of a couple of opinion leaders in the neighborhood. The other thing is that I think it's very, very important that you reach out to the faith community. And then, of course, you have to have meetings with neighbors. I would suggest that you do that in that order, though. You want to have some support from faith leaders, opinion leaders, political leaders before you start having the community meetings. But this is just a challenge that one should expect and prepare for.
Kevin, do you want to talk a little bit too? So I learned about zoning commission. I learned about city council. We had lots
Sure.
of great experiences. And I think the point and that Kevin is making is when you build a good team, you surround yourself with people who have skills and expertise that you lack, right? I mean, that's how you build a great team. And so.
Absolutely. And the thing about going in front of, and again, Lisa said she had not gone in front of a zoning commission before or in front of a city council for zoning before. And it is can be an emotional thing because the folks who are going to stand up and speak against you are people who think they really are speaking on behalf of the neighborhood, on behalf of their own neighbors, without really realizing that the services being rendered will improve not just the neighborhood, but the community as a whole. And it's do your homework, as Coach Popovich for the Spurs always says, do your work early. So if you are going in front of a zoning commission or you're going in front of city council for a zoning vote, you have to prepare yourself, meet with the officials involved, explain to them what's going on, and then solicit from current neighbors and others letters of support that will firm up their support for your project before you actually walk in the meeting.
Yeah, and this is Dr. Nolan, just to add in another barrier. Dr. Cleveland's amazing skills at attracting grant funding will not permanently support the Women's Wellness Campus. And so it needs to be at least a break-even proposition in terms of the care being rendered by skilled nurses, keeping the lights on, et cetera. And so we've learned a great deal about interacting with Medicaid, they're not adverse to innovation, but innovation does not come naturally to them. So that's another barrier that we continue to work through because we all have bosses, and some of my big bosses say, well, this is wonderful and your heart's in the right place, but show me where your wallet is. So you need to be prepared for that, in addition to, thank God I didn't have to go in front of city council and zoning. I might have said exactly what was on my mind, which wouldn't have been helpful to anyone.
You know, Lisa, if I can just jump in on this, one of the key things for everybody here, when people do go to speak against, you know, whatever it is that you're doing, and they really believe that they're speaking on behalf of the neighborhood, do understand some of that is, and they believe that they're right, is because number one, they don't know, but number two, they haven't been engaged. Within the treatment community in general, and this is across the country, treatment people talk to each other. And it's really important that you have to do the yeoman's job of a Kevin and a Lisa. You do. I've been working with communities and organizing communities for years, so I have been on both sides of being able to get something in a community or to keep something out of a community. And if people in that community do not feel the first time they see you should not be the time when you're trying to put something in their neighborhood. That is not the first time they should know who you are. You working with the community is that you are their neighbor. And I would honestly just have to say that partnerships, it's really important. And Lisa said this, Dr. Cleveland said this earlier. Just like a great marriage, you need someone who has skill sets that you don't have, and that you have skill sets that they don't have. The same thing with a great partnership. Treatment people are not in the business of housing. They're not in the business of the body politic. They're not, you know, and the whole nature of that is to kind of protect, you know, confidentiality and all those things, to kind of keep things closed up so that you can work and help people. And oftentimes the whole culture is to be real quiet and secret. It appears secretive to people outside of that, but to be, you know, more inward. When in order to make the continuum work that people need to move from where they are to get well is all about being external. So I would say to you all, for those of you who are looking at this, have someone. You got to have a Kevin, you got to have a Lisa, you know, you got to have people like that who are skilled, who have no problem walking in a room and shaking everybody's hand, walk in a room and give everybody a card. You have to have people who are doing that, who are outward going, because you're going to need them to, and people will support what they help create. So you have to, the creation of your solution has to involve the people that it's going to impact.
Thank you, Beverly. Look, and Karen asked about a physical location for the replication of Casa Mia in Fort Worth. And so that is the replication we're partnering with WestCare on. And to my knowledge, I'm not sure have you identified a physical location? Yeah, I know you're probably looking at several.
We are looking at several. And again, because we want to make sure that it's ideal, the most ideal place would be a place that, number one, is very close to all kinds of services, but just regular things, grocery stores, all those kinds of things that you want. And then secondly, that where we can actually be able to have a synergism with the women that are there. So we've got three locations that we're looking at, and there's a great place in Fort Worth that's actually in development. that might end up being really very good as well for for growth.
Thank you, Beverly. Somebody just asked in the chat about the Rio Grande Valley. We don't have partners for this particular work. Our team also is working with the state on some paramedicine programs. We have begun to work with the Rio Grande Valley to replicate the paramedicine program, as well as what we're calling an overdose prevention drop-in center. So it may be that is a community we'll target, before long, but also, the Casa Mia here in San Antonio is state funded. So we can accept referrals from anywhere. We occasionally have gotten women from other communities. Women tend not to want to go too far from home, but if, by all means, reach out to us if there's a woman who's willing. Give us a call and we'll see if we can help you. One of the things I did want to talk about when we talk about challenges, barriers, and I think Dr. Nolan kind of alluded to this. So as you can imagine, we are going to be opening an NAS center when one currently does not exist in Texas. There is no existing NAS center, right? And actually there's only a couple similar in the nation. Some of you may know of Lily's Place. It's in Huntington, West Virginia. It was one of the first. It's not exactly the model we're trying to create. We did ask Lily's Place to present at the NAS Symposium last year. So if you're interested in that, you can go back and watch that presentation. Again, it's not exactly the model we're trying to build. There's another one on the West Coast in Washington State called the PIC. It's a little bit different. It's really more of a nursery for newborns where the primary caregiver may or may not be involved. The one we are very, very similar to, and we just sort of stumbled across this, which I don't know how we didn't know about it, but it's called the Hushabye Nursery. And I believe Tara presented last week. Sharice, yes. Yeah. So if you would like to learn more about the Hushabye Nursery in Phoenix, Arizona, the model is almost identical to what we're trying to do here. And so she's been a huge help to us. We will be traveling sometime this summer if I can find time to get out there but she's been wonderful. She's agreed to share policies and procedures and protocols, but it still doesn't get us past the issue of licensure. I know in Huntington, West Virginia, they had to get some legislative intervention to get a new licensure type made. We did meet with Senator Menendez 2 weeks ago. He came to the School of Nursing. We shared with him kind of what's going on, and his staff has been great. They're interested in helping us. So sometimes sometimes it's better if you don't know going in, because we've just kind of had to figure it out as we go along. And ideally what we would like is for there to be a new licensure created, something that other states could then replicate, because you don't want every state to have to go through this same kind of thing as they're trying to provide more cost effective, but really great quality care for these families. Other questions or any other input from our visioning committee? Anything that I might have missed related to the challenges and hurdles and successes, right, Kevin?
Yes, and I do want to share, especially after Dr. Nolan brought up the idea that all of these projects involve a show me the money component. And I do think it's important to point out that last week we did get, Lisa and I had presented to the county commissioners of Bexar County, asking them for money. And I think it's important for the group to know that the county commissioners in their collective wisdom voted unanimously to give us $1.5 million from the opioid litigation settlement funds. So, and that's bricks and mortar, that's not for operations. But I do think it's important that anybody who's trying to replicate this be a little creative in where they reach out for funding. The cost of phase one is right about $7.5 million, and we've got 3.8 in the bank, or 3.9, and we think we have another 3.5 in queue. So I just wanted to point that out as a challenge and also as a potential solution.
Well, and to your point, Kevin, so going into this, you never know what you're going to encounter. I mean, who would have known we would encounter a global pandemic? right? So, I mean, it's, you got to keep rolling. And so the cost actually has gone up, right, Kevin, over time. And we've had delays because of that, but you keep moving forward. And, you know, I think the important point is that it gets done versus necessarily, we might've thought it'd be 2 years, maybe it's going to be 3 years now, but it is going to happen. So. And the other thing I think too is with, you know, I think with a lot of these opioid dollars, there's been a real concern that none of this money will actually go towards helping those that have been harmed. And so to me, to have, and that, Kevin, correct me if I'm wrong, that was the first money from the Bexar County opioid litigation to actually get earmarked to go anywhere. Is that correct? I think so. But anyway, so that was really exciting to me. Sister, were you going to add to that? I think you're on mute. Kevin, you're on mute.
Okay, thank you.
We can.
The other thing, Lisa, is this. Do you hear me? Yeah, okay.
Yes, we can hear you.
The other thing is this. You never know where you'll get money. Don't be afraid to ask. Don't be afraid to ask anybody, because you never know where you will get money. There's money in this town, and there's money in every town, and plenty of it. And so don't be afraid to ask.
Thank you, sister. Other questions or comments? Okay, so there is a question in the, will the public or the community be able to use the campus in any way? Kevin, do you want to talk about that? Because that was a promise you made to the community. And I think this goes kind of back to Beverly's point too, is you need to be a member of the community, keeping the community in mind and to not alienate the community. And so do you want to talk a little bit about our plans for that?
Well, I do, because when I met with one of the community groups, they asked if they would be able to use the clinic, which I said at this point, I didn't think so. But what we are doing, we're building an admin building that there are so few meeting spaces in this Delcrest area neighborhood that we have offered that the Delcrest Neighborhood Association can use our admin building for their monthly meetings, that there will be opportunities for them to come over and engage in some volunteer activities with moms and babies, perhaps around the garden or cuddling programs. But Lisa, as far as I know, I don't think we're opening this clinic.
That's right. Yeah. Yeah. And so it's more shared meeting space. And then also with the dining facility, which will be in phase 2, where we want that to be a very versatile space that could be, used for many purposes. It could be an exercise, for group exercise, but I think too versatile enough that if the community had a need for a larger space, that would be open for them to reserve, right, Kevin?
That is correct. And Sister Gabriella just pointed out to me, I can't believe I forgot it, another huge value, a benefit to the neighborhood is that we are going to be hiring staff at all different levels. So some very basic positions to some licensed positions. And when I met with the neighborhood association, they asked if that was for real. And I immediately sent them job descriptions and benefits and salaries so that they knew this was also going to be of economic benefit to the neighbors.
And John, I saw your camera come on. Did you want to add to that?
Yeah, I just wanted to mention that the efforts of the collaborative efforts that we've been undertaking actually have been fairly broad-based. Besides the visioning committee and the design committee, we've created several other committees, one of which, for example, is reaching out to find in-kind and other donations, diapers, blankets, cribs, all the things that we need for the ongoing operations. So there's been wasn't just about raising money to build the facility, because a vacant building does us no good. We really need a building that's furnished. We need a building that has supplies for all the ongoing activities. So there actually have been a lot of other people who aren't mentioned in this particular presentation who've been involved in helping us with the ongoing efforts for this campus. Thank you.
Thanks, John. And I did discuss, because of the need for the Del Crest community, which is a largely retired community. Am I correct, Verna? I believe that's true. And the need for primary care for seniors. And it was something I did discuss with my Vice Dean of Clinical Practice about the potential of maybe future partnering with the community. So maybe a clinic space, not on the campus, but within the Del Crest community, where, it potentially expanding our UT clinical nursing practice into that community to provide care for seniors. And she was very interested in that. So, I mean, that's something that we may think about in the future. And then Sharice, because her chat is frozen. Our School of Nursing also has a mobile unit, which is really, really nice. It's got, I think, 2 exam rooms in it. That's something I had not even thought about, Sharice. That's actually really brilliant. So, I think that there are a lot of ways we can partner with this community to serve the many needs. So Karen asked about daddies. So we do have a lot of fathers who are actively involved with our mamas at Casa Mia now. Kevin, do you want to maybe speak to, when it comes to residential programs, about some of the challenges associated with providing housing for moms and daddies? Are you there, Kevin?
Yes, I'm sorry. I had a little trouble getting on the right spot. Yes, so we have right now 7 programs. I would say probably 75% of our clients are men/dads. And one of the things that we found with transitional residential care is that it provides a cushion so that family members get the opportunity to get back together in a low stress environment, a home-like environment. So we don't have any programs where moms and dads are residing in the same place. But what we have found in Casa Mia, and really all of our programs, is that whether it's with moms or dads or just men or women who have burned some bridges in the past with significant others, with parents, with offspring, that when they get into a transitional care environment, and it's not as if they're just showing up on someone's doorstep, parents, spouses feel much safer coming in and reestablishing a relationship with their person who's been either incarcerated or in a behavioral health hospital or chronically homeless, where they get to see them in an environment where they're at their best. It gives the opportunity to reunite families. And I always tell people that all of the work that we're doing not only saves lives, it saves families, and it saves resources, precious resources, where instead of spending our monies on people whose primary presenting problems are behavioral health in nature, having them institutionalized, we're putting them in a community-based environment where they have the opportunity to reconnect with family members, to find stable employment, and begin looking for some housing that will sustain them. So I don't know if that answers the question, but we do not have actually programs where moms and dads live together.
And so also in the chat box, Kelly, and this may be more of a suggestion than a question, would it be possible to hold a job fair specific to the community or opportunities for community garden use? That's kind of interesting.
Yeah, and we have set up a couple of job fairs specifically for Crosspoint services. And again, because we have 7 very different programs, we have found that when you do that, you attract the attention of people with special interests. And let's face it, the Casa Mia thing with moms and babies is of interest to people. The most difficult part of it is that in a nonprofit world, the wages are not very high, even though benefits at places like Crosspoint can be very good. It's you're competing with places like Whataburger and Hobby Lobby, where wages are higher, honestly, than what we can pay at this time. So that's one of our largest challenges.
Beverly, do you want to add to that at all? Or maybe even Tiffany, thoughts about job fairs specific to the community or opportunities with community gardening? Or John, anybody have anything else to add to that?
Well, other than, I think that's absolutely key. We are actually working on a proposal and working with the city now to actually provide job training specifically for our population. So we're looking to do both federal, which we want to be able to make sure is on this campus. But again, you all, once again, it's important. This is one where, remember, you don't have to do everything. The treatment provider does not have to do everything. This is where you really want to be able to have a partnership.
Thank you, Beverly. I think that's a really important point.
Yeah, I think it's really important to have some kind of job training because, you know, we come from living on the street most of our lives. I think at Casa Mia, I started off at Luby's. That was the first real job that I ever had. So I think it's super important because we don't have these skills. And sometimes everyone's recovery is different. We all come from different backgrounds. So sometimes it's a lot more challenging for others, especially, you know, if you've gone half your life, not, you know, having any kind of job skills, life skills. It's something that, you know, we've had to learn because it wasn't taught to us.
You know, Tiffany, thank you for saying that because you said something that was very, very key. This is one of our key arguments. The city told me that the proposal we put forth was one of the best that they had seen. And the reason I had said that is because I was sharing with them and advocating that we cannot just expect people. They go, well, we have tons of job training programs. I said, you might, but you don't have a job training program for this population. Their needs are different. You cannot expect them to walk into a place and have already had job readiness skills. They know how to do a resume. That you all are doing, you know, you're trying to serve a population that doesn't need the same assistance as this population. We do need job training specifically for this population.
Thank you. And I think too, Tiffany, just the whole individual, everybody's in a different place, right? And needs different support.
Yes, and then not just that, not only are we trying to learn life skills, we're trying to learn how to be a mom. You know, recovery is a lifetime thing. Like, you know, I have to work a 12-step program and I'll have to work a 12-step program my entire life, you know? So when you get clean, it's a lot to take on your plate. It's a bunch of skills you have to learn.
Thanks, Tiffany. John, did you want to add to that? I saw your camera come on.
Yeah, I wanted to mention, you had briefly talked about our demonstration kitchen in our dining facility. It's actually more, I don't know if I would call it a demonstration kitchen. It's actually, speaking about employment, we have been working with one of the major catering companies in San Antonio who has told us, hey, we're willing to mount an entire kitchen facility, staff it, so that we can train the residents of this community to acquire culinary skills, and we will hire everybody who goes through the program. So the idea that I guess we're trying to make a continuum between our therapeutic garden, which will produce obviously not enough food to feed everybody in the wellness center, but would contribute to it. And so that we can create a stream of experiences for our residents that will lead to gainful employment. So we've tried to make all of our facilities serve more than one use. It isn't just that we have a kitchen and that we have a dining facility. No, we're trying to make it an engine for change. Thank you.
Thanks, John. So maybe we should call it a learning kitchen rather than demonstration kitchen. We can talk about that. I like that. So it looks like Cindy put in the chat box, being the PPI providers in Tarrant County, is there anything we can do to help or aid in the development of the Fort Worth project? That's a Beverly question.
And I just emailed, or I just chatted to Ms. Dinsmore, who asked that question, to please send me your phone number and your email. And the answer is absolutely yes. Like I said, we can do this together better together.
Agreed. And you know, definitely the plan is to, now that we can move about a little bit more and travel more, is to come visit the community and the Nueces County community. So stay tuned. And you also asked, where would someone need to go to look into volunteering in San Antonio? I think maybe right now you're thinking specifically about the Casa Mia program. You can definitely reach out to me or my team, or message through the website if you're interested in volunteering there. And then Samantha asked, is there, and this might be a Kevin and Beverly question, is there specific materials to learn from about job training for this population, in addition to the larger IPS model practiced nationally for supported housing and employment services? I think it's definitely Beverly question.
Yeah. Samantha, the answer to your question is actually, I think there is and we are testing this, but one of the things that we have added that is I think a real value added to success, and that is we have added two things. Number one is paid training, because what happens in many of the job training programs around the country is they expect people to just be very happy that they're being able to get the job training. What they don't understand is when you pull someone from trying to find a job or trying to search for a job to come sit in a classroom to learn how to get a job, you are putting them at a financial disadvantage. And so we do not do that. We actually do paid training, and we've been doing it anywhere from $12 to $15 an hour, because people still have the stressors in their household when they are not bringing in money. And we have learned that from so many people, that it's like, I got to get some, my family's on me, my kids are, my wife, my mother's on me, all of that. So we have done that to alleviate that. The second thing is we are using active peer recovery coaches, constantly, who are actually in the classrooms with people, in addition to working with them and going with them when they're going to some of their first job interviews, to just be critiquing and to be there, et cetera. And then the other thing that you have to really do is you've got to be able to do some outreach with employers so people are not walking into an environment that is not prepared, which can easily turn into a hostile work environment because we didn't do our job in terms of prepping the people as to who are the people coming to see them. And so those are three things that we have added that have really contributed to success.
Thanks, Beverly. And we have about just a minute left. Could you just really briefly, I think too, some of your programs also include childcare.
I'm sorry, Lisa, I didn't hear you.
With and I think so. We only have about a minute left. So childcare as well, is that provided? Because that's really important.
Oh yes, I'm so sorry. That is that's an absolute must. Childcare is absolutely provided. No questions asked.
Thank you. And Sharice, we're down to about less than a minute.
All right. Well, any final questions or anything else? Anybody else have any final thoughts? We welcome those.
Thank you everyone for joining us, and please feel free to reach out to us. I mean, we are happy to share what we've learned. If there are specific things you're addressing in your community, we're happy to provide that support. Just feel free to reach out.
And thank you everyone so much for being on today. And thank you panelists. We appreciate this. We are recording this and we'll put it online for CE. That way anybody that didn't get to watch today or had to leave can rewatch it later.
Thank you, everyone.
Thank you. Bye.
Bye.